Hello everyone, welcome to Dentospedia, which is the most trusted platform for any dental board exam. So today I'm going to teach you pleomorphic adenoma from the module of oral pathology. So let's get started with the topic. What is pleomorphic adenoma? So pleomorphic adenoma is a benign tumor of the salivary gland. It is called pleomorphic because it shows many different tissues pattern, which is a mixed tumor. So it is the most common salivary gland tumor. Understood? It is most common salivary gland tumor. So see, it accounts for 60 to 70% of all the salivary gland tumor, and 85% occurs in the parotid gland. Now less commonly seen in some mandibular gland and minor salivary glands. So most common tumor of parotid gland is pleomorphic adenoma. Understood? Now see what will be the clinical feature. So it is a slow growing, painless, firm mass in the parotid region and does not invade the facial nerve. So see, it is a slow growing, painless swelling which is firm and well defined, smooth and mobile. Now it is usually seen in the parotid region. Now facial nerve is not involved because it grows slowly and it is painless. Patients often ignore it for years. Now why it is called benign mixed tumor? See, because it contains a mixture of tissues. There is epithelial component which is ductal cell and mesenchymal component like myoepithelial cells. So there will be ductal cell plus myoepithelial cell. Understood? There will be ductal cells and myoepithelial cells. Now the mixture gives different appearance like myxoid or mucoid, chondroid which is cartilage like or fibrous areas. Understood? So histopathology. So this will be a encapsulated tumor and shows ductal epithelial cells, myoepithelial cells and myxochondroid stroma. Now the capsule may show pseudopodia which are finger-like extension. Now these pseudopodia can remain after surgery. So there will be a risk of recurrence. Understood? Now see, incomplete removal can cause recurrence and malignant transformation. So this malignant form is called carcinoma x pleomorphic adenoma. Carcinoma x pleomorphic adenoma. Understood? It occurs when there is an incomplete removal and it can cause recurrence and malignant transformation, which is carcinoma x pleomorphic adenoma. Now, what will be the diagnosis? So, ultrasound or MRI to know the size and extent of the tumor, or FNAB, which is fine needle aspiration biopsy. So, it confirms the diagnosis. Understood? So now what will be the treatment? So there will be superficial parotidectomy. Understood? Superficial parotidectomy to prevent the recurrence. Now entire tumor removed with the margin and facial nerve is preserved and it prevents recurrence. So simple enucleation is avoided. Why? Because there is a risk of recurrence. So there is a mnemonic: P for parotid, P for painless, and P for pleomorphic. Understood? So pleomorphic adenoma is the most common benign salivary gland tumor, commonly affecting the parotid gland, presenting as a slow growing, painless, firm swelling with a mixed epithelial and mesenchymal histology. Understood? So that was pleomorphic adenoma. So for more detailed video, please download our app Dentospedia and please do like, share and subscribe our channel. Thank you very much.